I'm Dr. Beth Ebel. I'm a pediatrician at the University of Washington School of Medicine. So HPV stands for human papillomavirus, and it's a viral infection that can spread predominantly through sex. The critical piece about HPV, and I think for parents to know, and kids too, that this virus infects your cells and it can stay there for your life. And that's the risk of HPV, because not only can it cause conditions like genital warts for men and for women, but the fact that it impedes the cell function means that it's a risk factor for cancers. Cervical cancers, penile cancers, and throat cancers. So men and women can both be affected. So the beautiful thing about that HPV vaccine is it prevents cancer. How many times can we say that? But the critical piece is that vaccine has to be given before you're exposed to this virus that doesn't go away. So the recommendations for the American Academy of Pediatrics are that kids would start that vaccine series at 11, and then they would just need 2 shots, to be fully protected. Just like you want to have your seatbelt on before you start driving, you want to get this vaccine before you're at risk of getting the virus. That's the critical piece. So right now, we're still at the point where fewer than half of eligible kids are getting this vaccine. So for me as a parent, I have a son and 2 daughters, and I want my daughters to be able to have kids when they want. And I want my son's wife, to be able to have kids too. And so, I want them to be healthy and well. And so I made sure that my family got those vaccines, when they were supposed to, at early, in that early adolescent period. So it's real critical to be getting kids vaccinated now to get them protected, so they get this lifetime protection from a serious infection and this cancer risk. Often there are no symptoms. So, that's a scary thing. And moreover, there really isn't good treatment for this virus, besides, treating precancerous or cancerous lesions when we see them. For females, the most common cancer is cervical cancer, and that's really affecting, the bottom of the uterus, which is what, we need that if we're going to have a family. For men, the most common cancer is penile cancer, and both men and women can also get throat cancers from this dangerous virus. I am very emphatic on talking to parents because I know how important this is for kids, and I care for their kids. I know they do too. This is the best thing to do for your son and daughter.